Opiate use disorder, known as OUD, is a serious public health topic and was declared a public health emergency in 2017 by the U.S. Department of Health and Human Services. OUD is a chronic, life-threatening illness that affects thousands each year. Opioids are commonly used pain medications that, when misused, can cause physical dependency and addiction. Commonly known opioids include heroin, fentanyl, oxycodone, hydrocodone, and morphine. Individuals may experience a variety of OUD symptoms, such as worse general physical health, taking increasingly higher amounts of opioids over time, having difficulty controlling the urges to use, giving up positive activities and interactions to use more.
In order to make the diagnosis of opioid use disorder, a person must exhibit at least 2 symptoms from this list within the last year. Some of these symptoms include physiologic tolerance or withdrawal, giving up on previously enjoyable activities for use, interpersonal problems relating to use, or the inability to cut back on use. We can go on to further diagnose the patient with mild, moderate, or severe opioid use disorder based on the number of symptoms a patient exhibits. It's important to note that there's a difference between opioid use disorder and opioid dependence. For example, when we experience a serious injury such as a car crash, we may need strong medications to relieve pain such as opioids. If maintained on such a medication for a long period of time, our bodies may begin to become dependent on their effect, and an individual may become dependent on opioids. While someone may be dependent on opioids, they may likely not need treatment for opioid use disorder.
Overdose occurs when an individual takes too much of a specific medication and experiences decreased respiratory drive and low oxygen levels. This can potentially lead to cardiac arrest and death. Overdose can happen to anyone, regardless of prior drug use history. General signs of a drug overdose include loss of muscle tone, decreased alertness, clammy skin, loss of circulation or color through the body, and vomiting. Signs of an opioid overdose specifically include pinpoint pupils, loss of consciousness, and decreased respiratory drive.
We want to avoid overdose. However, if someone is experiencing an overdose, naltrexone, also commonly referred to by the brand name Narcan, is a life-saving medication that can be used to reverse the effects of an opioid overdose, even in someone who is unconscious. It is an overdose reversing medication that is easily accessible and affordable. Anyone can be trained to use naltrexone, not just healthcare professionals. In most areas, including here, naltrexone can be obtained without a prescription, and it's free.
When someone with OUD stops using opioids, they may experience withdrawal, the body's reaction to the change in body chemistry, and it can be extremely uncomfortable. Symptoms may include pain, restlessness or anxiety, flu-like symptoms, inability to sleep, high blood pressure, blurry vision, and nausea or vomiting. There are certain medications that treat OUD that can relieve an individual withdrawal symptoms. A common example is buprenorphine, also known by its brand name, Suboxone.
Treatment is necessary for many substance use disorders, and the use of medication is very effective in treating opioid use disorder. The medications for opioid use disorder can reduce cravings and keep individuals out of withdrawal.
There are 3 types of MOUD, or medications for opioid use disorder: methadone, buprenorphine, and naltrexone. Each medication works differently on the opioid receptor, which is the part of the brain that makes the body respond to the drug. Methadone fully activates the opioid receptor. However, this does not mean a normal dose generates euphoria. Methadone needs to be taken with medical supervision to ensure safety and effectiveness. Buprenorphine, also known by its brand names Suboxone or Zubsolv, only partially activates the opioid receptor. Buprenorphine is an effective, low-maintenance method of treating OUD because it does not need to be taken under the supervision of a medical professional. It can be taken in the comfort of your own home. Buprenorphine is available in oral and injectable forms. Lastly, naltrexone completely blocks the opioid receptor. Naltrexone is available in oral and injectable forms. One form of medication is not better than another, but these options give individuals with OUD the ability to choose which medication works best for them.
We know OUD is a chronic, life-threatening disease, and with that, we know that patients who are on MAT or MOUD long-term have the best treatment outcomes.
Physicians, physician assistants, and advanced practice nurses can prescribe MOUD. We encourage providers to review the current federal practice guidelines and SAMHSA's website for more information.
An X waiver allows qualified providers to prescribe buprenorphine. There are different rules and regulations on how to obtain an X waiver based upon a provider's specialty and how many patients they treat. Please view SAMHSA's website to view the current guidelines.
Opioid use disorder is a complex challenge for both individuals and communities. Despite the great success many patients have with MOUD, there are still many barriers to accessing treatment and remaining actively engaged. Some of these barriers include fear of disclosing health concerns to family members or medical professionals, lack of transportation, the cost of treatment, and limited insurance coverage.
New York Matters is a collection of resources that aims to initiate care and quickly link patients with OUD to appropriate treatment. In conjunction with the New York State Department of Health, we have developed an electronic referral platform to facilitate referrals. Patients can choose an appointment date at their preferred clinic, usually within 24 to 48 hours, opt in to be linked with a peer for support, receive a medication voucher, and receive transportation assistance all throughout our program. Please view our website to view more information about our program.